Okay, let me pin a comment. What are we pinning as a comment?
PRP to make me look 12.
PRP to make me look 12. With at Dr. Canaris. There's no underscore, right?
No, it's just one word.
Okay. Sorry. I'll try.
So like we said, the skin under the eye is the thinnest.
Okay, so we have 400 people here. Hi, person from Cleveland. So we're doing something called PRP. What's the full name?
Platelet-Rich Plasma.
In brackets, vampire facial. And basically, we take a little bit of blood and then we separate it and then we take the plasma and inject it into the skin to
Stimulate
I
collagen.
wanted to say encourage, and I was like, that's not the word. And stimulate collagen. And the thing is, it actually doesn't hurt because she's numbed my skin, guys. So she's putting it in there so that I don't get those lines. It's not painful at all. And I hate needles, but I actually don't hate them when I'm here because I have a plan. So I'm just letting people know. You guys see your favorites scamming you, acting like everything they have is all natural. It is not. They're lying. Some of them have surgery, fix their bodies and stuff. We do stuff to look beautiful and young and maintain whatever it is we maintain. So don't get scammed. I'm going to show you guys what we do. This is one of the things I do to always kind of keep my skin fresh, happy, and rejuvenated. It's called PRP, and I really love it. So enough of being lied to, because you guys are definitely putting yourselves under unnecessary pressure when we could also be showing you what you could be doing to have the things we have. This is my doctor. Where is she? Dr. Canaris.
Hi.
I love you, Swanky. You know I'm always here for that. So...
Can one for that eye first? So what does this help with, Paul?
Oh. So I want to look 12 forever. I'm joking. This helps with preventing wrinkles because the collagen is stimulated to come to the surface of the skin. Usually in like between 2 to 4 weeks, I have like this long-lasting glow, which is what I love about this treatment. Other treatments, you have like a glow for like a few days. With the peel, the glow I can say was about 2 weeks, but like when it was at its prime. And with this, it's like for about 2 months, I feel like things are great. So that's what I really love about this treatment. And for someone who doesn't like needles, as you can see.
Are you feeling anything?
No, I feel absolutely nothing. See, she's wiping off a numbing cream off my face. Because they numb your skin before they start doing this. And then for 2 days, I must stay away from the sun, right?
Yep.
When can
And sun protection.
Oopsie. And when can I exercise? Tomorrow.
Tomorrow, because we're going to do a bit of toxin as well.
Yeah. Because I was starting to get a vagina here, and I don't like this. So she put something so that my brows move a little bit, so that I can prevent having a ton of wrinkles in that area.
But because you're an actress, we want movement. We just don't want
100%.
lines. So we keep your expression, but we remove the lines associated with it.
Does anybody have questions? Let's look for questions. But it has to be about what I'm doing. Is your tattoo permanently? What? No, babe, this is not painful at all. Otherwise, I wouldn't be live right now. Is it like Botox? Is it like Botox? Not really, no.
No. So this is your own blood that basically has growth factors, and it stimulates regeneration of your skin. So that's what PRP is. Toxin, because we're not allowed to say Botox, because it's a trade word, basically relaxes the muscle. So any muscles that cause expression and cause deep lines, we treat with toxin. But this is to stimulate, heal your skin. So if you've got acne scarring, if you have pigmentation, if you want to just keep your skin looking good, young, even toned, this is probably the Rolls Royce treatment.
The Rolls Royce treatment, yes, girl. And I wonder, I see some of my friends looking a bit older. I'm like, not me. Guga, oh, Tandayo, but you're bleeding. She has a tissue. Yes, because there's a needle.
We want bleeding because bleeding means that we're on the right level of the skin.
Yeah.
And so I'm actually injecting this. So if you look, I touch her, and as I'm touching her, I'm actually injecting a drop. So we want blood.
Sasa says, why are you doing this, Pearl? Your skin looks beautiful naturally. Oh, you thought that I was all natural? Okay, girl, call me in 12 years. We'll see who looks natural. I don't want to do stuff. I don't want to do surgery. So I'm doing this so that I can maintain what I've got. Yes, I'm gorgeous as fuck. Of course I am. But I'm in for service, as it were. The price range, I don't know if doctors comfortable.
They can DM me and we'll discuss their specific case and give them prices.
Based on what you need.
Yeah, so we need to assess you. Everyone's different.
So I used to have lots of pimples. So I developed on some parts of my skin pigmentation, and this has really fixed me up. You can hardly tell that I used to have serious acne problems. So just DM her and then she can explain to you what you need. I'm not feeling any pain because we have numbing cream. So no, it's not painful at all.
And also we're using the tiniest of needles.
It's a super tiny needle. You said it's like the size of a hair.
The size of a hair. This is a 32 gauge. Around your eyes and on your forehead I use the 34 gauge, which is even smaller. So the higher up you go in numbers, the smaller the needle becomes.
Okay.
But this is a little thicker because the skin here is a little thicker, so we want to go a
I'm
little
feeling
deeper.
it a bit more here. But it's not unbearable. It's
So
just
this is your area where you usually feel it.
Yeah, it is. It's okay. So I hate these lines, and this has helped me a lot in managing. What do you call those lines?
Nasolabials.
Nasal labials.
Nasolabials.
It sounds like nasal labels. I'm joking. Nasal
Labial. Not like that labial.
Not like
labial
my cookie.
as in lips, the upper lips, not the lower lips.
No, man. My cookie was just itchy, sis. Don't be scared, guys. Look, pretty hurts, but this doesn't hurt. I swear to God.
Okay, so we're going to just do, I think there's a drop here. Can I get a web call?
Okay, so sometimes here it's a little bit ouchy, but rather that.
Just because we're going a little deeper, that you may feel it.
I do this every 4 months, yeah?
Yeah, well, we do the toxin every 3 months, and then this as well. Sometimes we do a peel in between, which we did last month. You okay?
Mm-hmm.
It's just a bit deeper.
So you only need to do this about 4 times a year. Not need, but...
So this can also help with hair growth. So, braids and traction alopecia, it really helps to regenerate the hair and thicken the hair at the hairline or wherever else you're losing hair.
So if you have hairline problems, this is probably where you should come. Because people who lie and say they can bring your hairline back with hair products are lying.
Out of 10, how sore is it? 10 being the most, 0 being nothing.
1.
Because I think that's what most people feel. They see a needle, they see blood, they think,
No.
oh, this is going to be sore.
Someone asked, what is that Vela? It's called PRP. I like using the other name, but I don't think she likes it. I usually use it when I'm alone, because if next to her, she might get... So I have really bad pigmentation here at the moment. No, it's not really bad. It's, for me, it is. Because it looks like I have a moustache. And no, my face doesn't swell. And in about 2 days, I look normal again. For one day, I just feel a bit... Sometimes I don't, though. That's an interesting thing. Like, there's just a little bit of redness and sensitivity, but it's not like, oh my God. I just have to protect it from the sun. See, look.
And then we just add a little bit. So you see, every time I touch the skin, I'm actually injecting. And you can see those tiny little dots.
No, it's not painful, guys. I've been saying. DM Dr. Canaris. I put her handle in my pinned comment, and see what she can help you with and what you can afford and whatever. So yes, it does help with hair growth. So it can rather.
So Kim Kardashian actually made this famous, and when she did it, she was crying, but that's because she was actually pregnant, and they never put any local anesthetic cream. So I don't know if you've seen all those photos with her with blood smeared all over her face.
Really?
Yeah.
She was crying?
She was crying.
Why didn't they numb her face?
Because she was pregnant. So when you're pregnant, you can't have the local anesthetic cream.
Then why did she do the thing?
To improve her skin.
Hectic.
But listen, it's not that sore. Obviously, also entertainment value is always nice.
She's always crying though. So they put a cream to numb your skin. You are bleeding. Guys.
That's what we want.
Like, of course. But you are blooding, as you see now. You probably...
So there's not going to be any bruising. You can see if I wipe. There's zero indication that we've even injected into the skin.
You guys act like you're afraid of bleeding, like you didn't play in the street and hurt your toe and actually bleed. This is not even bleeding. Like, you guys, some of y'all are bleeding every month and buy products for that. You want to cry about this, please.
So we want it to bleed because it means that it's in the right level and that level has blood vessels.
I can't wait for that pigmentation by my upper lip to go.
We've also got to give you some products for that. And just tell me what you got last time so we can see what we can add.
Me mensa every month can put you bleeding. Seriously.
Okay, let's try it on the nose. This also helps with pore size. You just let me know if you feel any pain. Sometimes it can just feel a little bit weird. Are you okay?
Mm-hmm. I mean, I want to go to the club with Tando one day, and I want people to be like, oh, is that your mom?
You don't want them to say you're a MILF. You're going to be the best friend. Like the...
I know, the older sister.
Exactly.
Mm-hmm. Please DM the doctor for information about the procedure. It's kind of like not sexy to be talking about prices here, guys. It's not like...
And also we need to assess you. So, it's no use providing you with a price if we can't tell you what you need. Everyone is different.
Because you might only want it on your hairline, maybe. Maybe you only want it in a... I don't know if you actually do it that way, but...
Well, we've got different packages. We offer it with drips if you're wanting brightening of your skin.
She also does it to make your vagina nice. I haven't done that one yet.
It's called the O shot.
The vagina one is called the O shot. Okay, I haven't done the O shot. I actually need to do the O shot to make my vagina sexy since it's been doing nothing so long.
It's been in quarantine.
Yeah, it's been in quarantine. Take care of your skin, guys. Like I said, your faves are doing surgeries, fixing their stomachs and their bodies, and then scamming you with Facetune also. And then you guys feel like you're not beautiful, or you feel like you're not good enough. No. You're beautiful, you're good enough. You just need to learn how to use apps on your phone and find the doctor who can make you amazing. Because people are definitely like flying to Los Angeles for surgeries and stuff, which is fine. It's allowed. Just you there at home. Yeah, own it, but also you there at home. Don't put yourself under that type of pressure. It's not fair on you unless you also have the money to do these things.
So we're doing the neck, which is quite cool.
See, I've got like a little scar there of pigmentation.
What are you going to help with?
Ooh, okay, I felt that one.
Because it's a scar.
Yeah,
the tissue under it is not normal, so that's why you'll feel it more. But are you feeling anything else?
No.
So we call this a necklace. I'm giving you a pearl necklace.
I felt that one.
Maybe I'm going too much to the side here. We didn't put cream. So we're giving pearl a pearl necklace to help with technique.
And technique is because we're always on our phones, so we're getting lines on our necks and looking old. And people are like, oh, you're so beautiful. Why are you doing this? Why do you think I look so beautiful? Sorry.
We want to maintain, guys. Pearl is beautiful. She was born beautiful. But we want to keep her skin because we all age. God made us that way. Nobody's different. So the skin needs to stay young and be supported, have collagen enhancements. And, you don't have to do anything major, but it's constant upkeep, isn't it?
Mm-hmm.
Like Jim.
I felt that one a bit.
Do you feel this one up here? Faye, come this side for me.
No, but I'm fine. I'm just being honest with you guys, because what is that she's injecting? Plasma. No, it doesn't hurt. Platelet-rich plasma. So it makes you, it stimulates the collagen to come in your skin. So that's what repairs your skin, makes it nice and tight, prevents wrinkles. And I'm not trying to have wrinkles. See there. Let me see if there's more questions. Are there any side effects?
No, because it's natural. So it's from
your
your own blood.
It's from your own blood.
There's nothing else in here but your blood.
Sorry, that one.
I'll actually show you the tube so that people can see. So in this tube is just red blood cells left.
See, that's what we don't use from the blood.
So it separates the blood, and then the yellow stuff is what we drew up, and the red stuff is what stays behind. But there's nothing else in this tube. So it's all yours. And we just draw it up in a syringe and we inject it.
Technically, this is all natural because it's all my blood.
Exactly.
It's mine. It is natural. Does your face swell after? No, my darling.
This is how it looks.
This is basically what I'm going to be looking like for the rest of the day. And I just go home, chill with my kids. See, the lines are already starting, so I don't want to have those lines. I want to punish you guys naturally. Because one of my favorite...
I'm going to do toxin.
Oh, okay. One of my favorite compliments I always get is that...
Your skin is great.
No, I look better in real life.
Really?
People always say that to me. It's like...
That's a massive compliment.
It's like every day. Oh my God, you look so much better in real life. The camera doesn't do you justice. And I look pretty good on camera. So I'm like, that must be a really pretty bitch.
That's a huge compliment because you look amazing in your photos.
So shout out to those people who say that. So this is the toxin to relax the muscles on my face.
That cause deep lines. So far?
That cause deep.
So we're just going to stop that very deep movement.
Oh, but also now my face is numb. So it's not doing what it was doing earlier. So that's to relax the lines so that I don't serve. You know those lines that are here? We don't want those.
We're going to do a drop on your forehead as well. Here we just want like a nice open eye area and also just relaxation of the forehead muscle. You okay?
I just don't want to move too much.
And we've got 4 more here and then just your eyes. There we go. Smile for me, big smile. It wasn't much, but we're just going to do one drop here.
Yeah, because once you get those wrinkles, it's over. The ones here.
Around the eyes.
Someone's asking if it's for all genders.
Yes.
Your skin doesn't have a private part, darling. It's for everybody who wants to look gorgeous and maintain a youthful look.
And we are done.
Does it affect eyebrow movement? There's also one where you needle. The one's also nice, but this one is like for deep, like inside, like the things. That one's nice. It's great, but you can go deep with that one as well, right?
You can go.
This one just
2.5 mils, but I have more control here, and I like it because I can go deeper on into the eye area, and I can control the depth and
of what's happening.
And it's
so these procedures are lots of different ways. That's why we can't be like, oh, it costs this much, because we have to find the one that's right for you. Is this session 100% safe? Is the way that will it not bring side effects in the future? Okay, I think we've already answered that. What happens when you stop using it?
Nothing.
So in Christmas, I'm the bitch to look out for. Like around Christmas time, because then I'll be looking amazing. I swear a lot. I'm sorry. Okay, fine. I'll stop. Can men also use this treatment? Yes.
Yes. And great for their hair. Specifically because men lose their hair, they start balding. So it's great for the hairline, and it helps to strengthen the hair so you don't lose it. Also good for large pores, pigmentation, pimples. Exactly, pimples. It helps to sort out the environment of the skin so you actually don't break out as much. And also if you have scarring from pimples, it will help you sort out those scars. PRP to make you look well.
If you see a question, does it help with acne? We've answered that.
Yes, that
How long does it take?
So, I mean, we haven't been doing this for longer than 15 minutes, and we did the toxin treatments.
Okay. And then...
It's in the thousands, but if you'd like to find
expensive
out
is relative.
DM me, and I can give you pricing according to what you need to do. So we can do a virtual consultation, see your skin, assess you, determine what you need. And remember, this is not in isolation. It's like brushing your teeth at home. You still have to go to the dentist. You still have to use toothpaste. So Phil's done this in the clinic, but she's going to go home and she's going to use great products on her skin. And that's going to also assist in keeping her skin looking beautiful and radiant.
Okay, we'll do one more question. But a question, no, there's no disadvantages to this.
Her kids are beautiful, yes.
Yes. Is that not painful? No, it's not painful. How often do I do it? I do it about, I think, 4 times a year.
About 4.
Maybe 4 to 5 times a
year.
Wow, really. Do they stop pimples that comes every time you go on your period?
So that's hormonal, and you have to sort out your hormone levels. But it does help with the inflammation around it. So you won't get scarring from it. It will help you with the scarring.
That's the last question. Retired. Okay. It's been good, guys. Now I'm just I always feel a bit weird initially, and then I feel great afterwards. Oops. I didn't show you, I promise. Anyway, my doctor's name is Dr. Canaris, Nicole Canaris. I've put her handle on the pinned, almost at the pinned tweet, the pinned comment. What if you have skin allergies? Will it be good? Will it be a good idea to use it?
Yes, because it's natural.
It's natural. We're using what's already in your body. Someone said, clearly they were teenagers. They're like, oh, that auntie has nice eyes. They've been going on about your eyes.
That's all you can see.
Okay, we've done everything. Needles on my forehead, not in a million years, unless if I had to drink medicine. You know, can I tell you something? I realized I'm only afraid of needles in my bum because when we were kids, when you used to get an injection with the doctor, they used to hold me down and then, oh, see, I don't want this. You came here today. Not gonna stand for that. But I realized I developed a trauma with needles because of that.
So the pain association
is actually because I realized if you try and go to my bum with a needle, I'll actually pass out. But anywhere else in my body, I'm actually fine.
So it's an emotional trauma, like post-traumatic stress.
Like, I actually once, like, nearly, like, cried on a set because they were giving everybody vitamin B shots and I needed one. But they wanted to put it in my bum, and then
that is really sore. The vitamin B shots in your bum is
and they kept
sore.
lying, and I think as a kid they used to lie and say it's not going to be sore, and then I think my muscle was sore for days afterwards because of how they did it. So anyway, that's why I don't stress. And look, guys, I'll do anything to stay looking good, cute, like, so that I don't have to always be using Facetune and stuff. Like, anyway, bye.
Cheers.